a very valuable resource. And thank you very much. Thank you. Thank you for all of the work that you've done with us, and congratulations, and we wish you a lot of success.
Thank you.
With that, why don't we take the roll call and make sure we have a quorum? Right. Dr. Ford. Oh, she goes here. She's not in the room, she's here. She's here. All right, Ms. Kerr?
Here in Carson City.
Dr. Jameson? Here. Ms. Lewis? Here. Ms. Johnstone? Here. Ms. Atkins? Ms. Atkins will be joining us for the interview process. She's out of town, but she'll call in for that. Okay. Georgia Cheska?
Here in Carson City.
Thank you. Commissioner Kipper?
Very quickly, it'd be great if,
And this will no longer be Mike Holdings, will be Romaine Gilliland.
Here.
All right, and, Ms. Campbell? Here. All right, we have a quorum. Shall I do it again? Turn the mics up in person. Sure. Melissa, did you hear that? Can you turn the mics up in Carson City so that we can hear you a little bit louder?
Okay.
Is Ms. Kerr there in Carson City or on the phone?
I'm here.
Melissa, can you flip the camera so that we're not looking at the audience, we're looking at the committee? There we go. There we go. Thank you. Can they turn the mic up anymore? Can you turn the mic up anymore? Issue. There we go. Perfect.
Is that better?
Much better. All right, thank you. If you can't hear, we'll go back to the mic. Okay. All right, let's go ahead then and start with public comment. Do we have any public comment in Carson City?
None.
All right, and do we have public comment here in Henderson? Would you like to come forward, please?
I'm also prepared to speak briefly with the board.
Oh, please, thank you.
Or I'll give you the other copy.
All right, and if you would give us your name before you testify, please.
Len Barron, B-A-R-E-N-D.
B-A-R-E-N-D.
E-N-D. Yes.
Thank you, Mr. Barron.
You're welcome.
Please go ahead.
I want to preface my remarks by saying I'm an independent insurance broker here in Henderson. And I have some comments I think that are perhaps good for the entire situation. I want to express my concern for the thousands of examiners that have signed up on the exchange and will have to do it over again in 2014 in November. This appears to be a waste of time for the clients and the brokers and navigators that have to assist the clients in completing the task. During the prior open enrollment, it took an average of 2.5 hours to complete an enrollment. I, as a broker with many clients on the exchange, would appreciate if the exchange would come up with a transition plan to move the current clients onto the new program. Either have the carriers provide the information or have Xerox provide the data. I assume that Xerox cannot count for many reasons, but why can't the carriers provide the information that most certainly they have in their possession? You will be saving many Nevadans the time and energy for something they already have, insurance, and save the brokers and navigators the time and expense to re-sign up current clients. That would leave us all time to sign up new enrollees and heretofore have not signed up, which helps everybody. Increasing the number of insured in Nevada would be the first priority. I hope that some transition plan can be developed that frees everyone up to be more productive.
Thank you, Mr. Barron. I appreciate those comments. Thank you.
I believe this is for the board as well.
Thank you very much. I will post that on the website then.
That's fine. Thank you.
Yes. Okay, and there was another public comment that was posted to the website today, and I think that came from Lucilla. Is that correct? Yes. All right, is there anyone else here in Henderson? Okay, we'll go ahead and close that agenda item and let's move ahead to approval of the minutes for May 20th. Do we have any corrections?
This is Lester Johnstone. I would move for approval.
All right, is there a second?
This is Levon Lewis, I would second the motion.
All right, all in favor of the motion?
Aye.
Any opposed? Thank you, the motion carries. The minutes of June 12th. Any additions or corrections to those minutes?
Mrs. Glenn Lewis, I move approval of the minutes from June 12th.
Thank you, and is there a second?
This is Florence Jameson, and I second that motion.
Thank you, motion and second on the floor, all in favor?
Aye.
Any opposed? Motion carries, thank you. And lastly, the minutes from June 18th. We have any additions or corrections to those draft minutes?
This is Leslie Johnstone, I'll move approval.
Good, and is there a second?
Mrs. Glenn Lewis, I'll second the motion.
Thank you. All right, all in favor of the motion?
Aye.
Any opposed? Thank you, the motion passes. So we have approved those minutes for the 20th of May and June 12th and 18th. We are going to move past the interview for the candidates in hopes of getting a message shortly that Mr. Gilbert has landed at McCarran Airport. So let's move ahead to agenda item number 6, staff quarterly reports. And who is going to conduct the reports before?
So each of the members are going to present their own section of the report.
Okay,
So we can start with the financial section, and that would be Carrie Eaton, our finance and research officer.
all right, Ms. Aiken.
Thank you, Carrie Eaton, for the record. This is the fourth quarter for state fiscal year 2014. And during this quarter, staff had submitted a supplemental funding request for our level 2 establishment grant in the amount of $11,620,508. This request includes additional funding for a project management office, a full-time deputy attorney general, marketing and outreach, and provides funding for enrollment assisters. Additionally, this includes healthcare reform eligibility engine projects for CMS mandated system changes to verify lawful presence and security consulting services. We did find out today that this request was approved by CMS today. However, they did reduce our amount by about 12%. So the supplemental request was approved in the amount of $10,227,300. And then there is a chart on the bottom or in the middle of page 2, just outlining where we are, where we ended during that period. There are expenses still being paid out of fiscal year 14, so this will change before the budget gets closed. Thank you.
All right, do any of the board members have questions of Ms. Eaton on the financial reporting? All right, thank you, Ms. Eaton. Stakeholder outreach, that would be CJ. Mr. Bowden.
For the record, CJ Bowden. In stakeholder outreach, our requests for presentations has declined dramatically with the close of open enrollment and the close of the special enrollment period. Over the past quarter, we produced 4 informational presentations reaching about 157 individuals. Moving into marketing and advertising, all of the information portrayed in this report is going to be given in depth when we do a KPS 3 update later on in this report, so I won't go over these line items until we hit that. In the marketing and update report, we'll also be going over the survey, post-campaign survey and awareness to find out where the advertising campaign ranked and the number of awareness for individuals here in the state of Nevada. One thing I would like to touch on is the very last paragraph. In February of 2014, the contract with KPS 3 was extended until March 31st of 2015. We received those extra grant funds today. We will be moving that forward to the BOE for a contract extension on the original contract. And in the August board meeting, we will bring forward the requested RFP process for the next open enrollment period or plan year 2016 open enrollment. If there's any questions, I'd be happy to answer those now.
Do any board members have questions for Mr. Bowden? All right, thank you. And who is going to do quality assurance activities for the quarter?
That would be Laura Rich.
Ms. Rich?
For the record, Laura Rich. On December 12th, the board approved the Exchange Quality Assurance Plan. The plan was broken out into 3 sections: the sociometrics, operational benchmarks, vendor performance, and peripheral services. So as we reported last quarter, the exchange has focused much of its QA efforts on consumer concerns, with the substantial amount of constituent calls and consumer issues that have come into the exchange through other agencies such as various congressional offices and the Division of Insurance and the legislature. Much of the emphasis has been placed on working with Xerox to not just resolve errors on a system-wide scale, but frequently on a case-by-case basis. So this has actually been very time-intensive for the QA staff. And even though open enrollment and special enrollment periods are over, the exchange continues to receive these reports from state agencies and brokers and consumers, and this requires constant attention and resolution. So the first part of the quality assurance plan concentrates on the sociometrics, and throughout the open enrollment period and extending through the special enrollment period, the exchange has been required to provide weekly cumulative metrics to SSHIO. SSHIO also requires a more comprehensive quarterly report comprised of about 800 data elements. And due to system and reporting limitations, the exchange has only been able to provide about 169 of those. But because the reporting requirements were developed so late in the game, many of the states are experiencing very similar situations. And to the best of my knowledge, I don't believe that any state has been able to produce all 800 data elements. So the second part of the QA plan focuses on the exchange strategic plan. It is broken out into 5 distinct goals with identifying benchmarks which were developed early on by the exchange. And as you can see, some of the goals outlined in the strategic plan were met and others were not. Due to reporting limitations and the errors that users experience through the portal, the exchange was unable to provide reliable data for the 5th benchmark pertaining to the enrollment and the rate of progression through the portal. I want to point out that there is one correction on number 3, where it's the results for 6/30. It should say 18 employers enrolled by June 2014, not January 2014. The last section focuses on peripheral services. So these are functions such as our navigator program and broker and agent audits and surveys. The exchange has established oversight through grant reporting, but this area is less benchmark driven and more reliant on marketplace feedback and consumer need. So moving on to enrollment statistics, I'm just going to focus on the enrollments. We're out of open and special enrollment, so these numbers are not going to change much. Our new enrollments are limited to qualified life events, QLEs. But as I mentioned earlier on, we are having a significant number of consumers who Xerox is still working on to resolve issues, so this will affect future enrollment numbers. So we do have 37,933 enrollments in a QHP and 30,707 in a standalone dental plan. And the next table shows the majority of the enrollments were enrolled in silver plans, with most of the consumers being eligible for APTC. So with that, I'll take any questions if you have any.
Do board members have questions? Yes, Dr. Jamison.
Dr. Jamison, for the record, I was just curious if we have information on the other states, even though you said none of them met the 800, do we know which one of the states, of those states out there, have had the best performance, on this metric system?
So for the record, Laura Rich, so SSHIX actually releases these reports on, I believe, a monthly basis. They only release certain portions of it, so very little of what we provide to SSHIX is released on a national basis. I don't have those numbers. I believe that those go to the executive director every month, the state reporting from CMS. But again, very limited information is released. So we provide a lot of information to CMS, but they only release a very insignificant portion of that.
Is it available on request?
It is, and I believe that I can request that from our executive director and pass that along to the board members if they so wish.
I'm just really interested how we compare with other states.
Okay. If you'd like her to get that for us, let's go ahead and do that. Make sure that we get that information to the board. Did you have any other questions, Dr. Jameson?
Yes, so I would point out that if we start looking at Nevada compared to other states, Nevada is the only state that counts their enrollment based upon its payment. So all of the other states count their enrollment based upon submission of, I've picked a plan and I hit that submit button, but I haven't yet paid because we're the only state that ran the payment through us. So it definitely is a difference, and you would see that difference looking state to state to state. So what I would suggest is that we try to drill down a little bit and not just present the information, because CMS is not giving us apples to apples, and I would not want the board to give you that really skewed result.
For the record, this is Laura Rich. So she's right, Shauna is right. The way that CMS reports this is basically on confirmed plan selections. So it wouldn't be enrollment numbers, it would be confirmed plan selections. This is how other states are reporting their enrollment figures, whereas Nevada only effectuates enrollment or counts enrollment when it is paid and effectuated.
Any other questions? Ms. Rich, let me ask a question. Of the 169 versus the 823 elements, if you were to categorize them, is there a particular category that we did well and others we did not do well, or is it just across the board?
So for the record, Laura Rich, are you asking compared to other states, or are you asking what information we can provide versus not provide?
Well, of the 823 elements, I would imagine some of them could fall into distinct categories. And my question was, if that is a correct assumption, did we do well in any one particular category, or were we just lacking in all of them?
For the record, Laura Rich, we were able to provide a lot of information on enrollment on a very broad scale, but SSHIX was requesting enrollments on a very granular level. So for example, based on FPL breakouts, on age, on demographics, and we were unable to provide any of that data. We couldn't break it down to that level. So a lot of these data elements that they're asking for they're very granular, very down to the demographic. If they're in a rural, if they're in a depending on the FPL level, things like that. So we were able to provide just very general information. I believe a lot of the other states are able to provide that information. Again, like I said, a lot of these reports, a lot of the elements were they were developed late in the game. So the states were not able to accommodate the request of SSHIX because we were unprepared. We didn't know how to develop these reporting tools in order to meet these requirements.
Okay, and then lastly, do you have any idea of what the volume is like with respect to qualifying life enrollments?
So So, for the record, Laura Rich, I don't at this time. I have asked Xerox to provide a breakout. I know that so any of the change in enrollment statistics are due to terminations, qualified life events, or this group of people that are still trying to get through the process and enroll. So we know that the change in enrollment numbers are due to one of those three events, or three buckets of people. Xerox has been unable to break those out for me, but I do have this request in.
All right, thank you.
Yes.
Oh, Dr. Jamison.
Florence Jamison for the record. I would just like to have us keep in mind that as we move forward with our new system, I'll be particularly interested in the federal system we're temporarily linked to. How many of these metric systems are on theirs, all 800 of 800? And I'll be very interested to see, how well, if they are, that we instruct people to get that information in so that we can pick it up on the other end. I know in my office with meaningful use just on the new electronic record keeping, sometimes that stuff is in there, but it's quite an education for everyone to enter it.
So for the record, Laura Rich, we will be providing later on, I believe it's in Mr. Haycock's report, a gap analysis. And just moving on to the FFM, we will be unable to get a lot of this data that the board has been receiving as far as enrollment statistics. We will be dependent on the FFM to deliver that information to us, and as of today, we don't know exactly what we will be receiving, but we do not expect it to be at the granular level that the board has been receiving today. Whether or not we can get that directly from the carriers is an option, but again, this is something that the exchange has to explore.
All right. Ms. Kerr, any questions from you?
No questions, thank you.
Okay, and what about our ex officio members? Any questions on the report from either one of you? Thank you. Let's test that here. All right, let's go ahead then and close agenda item number 6 and move on to agenda item number 7. The board review of exchange plans to procure services from Nevada Public Health Foundation to resolve the premium billing issues. And I believe that Mr. Bruce is going to handle that for us. And in Mr. Fisher's absence, I will be recording this. So the purpose of the report is to provide information to the board regarding the intention of the exchange and the progress of the exchange staff in hiring an outside resource to come in and help Xerox with the billing issues. We've been speaking with Xerox, and while they are making headway and doing a lot of reconciliation, there's just a lot of reconciliation to do. And it's, at this point, we felt it was time to bring in an outside source, see what we could help. We're looking at all of the different avenues to do so. And so what we have currently, if you all recall, we have 3 contracts that we use for consulting services. So with CSG, with Milliman, and with PCG Consulting out of Boston. So what we do in this case is we write up a preliminary scope of work and we send it off to those 3 companies and we say, you have a current contract with the exchange, are you interested in performing this work? If so, let's talk about it, let's get a quote together and see what we can do. Are you interested? So we sent that out Monday. As of today, we have had a response that we would be receiving bids from 2 of those companies. We have received bids from 1 of those companies. When we have the final result, we'll come back together. The staff will look at those, make sure that it works. It covers all the parts of the scope of work that we're trying to do, and then we will write up what's called a work order. And those contracts are built entirely to be able to do a work order. You don't have to go back to DOE. You don't have to do anything. You're just using that authority that's already there. So we do have 2 companies that are looking at doing this. The 3rd company at this point declined because we were looking at it to happen over a 2-month period, very quick.
And they were just concerned that with the resources from their company that they already had out there, that they couldn't provide us with that service. So the board report itself, I won't read it to you, but it does go over kind of the areas that we're looking at. We're looking at having them come in and help us with corrections and reconciliation of the actual billing and payment process. Looking at actually all of those accounts, we've got 37,000 individuals. We want to make sure that they receive the right payment, it was applied to their account. We want to make sure then that the 834 and 820 and ACH processing time over to those carriers, that the information was correct and that the carriers have that correct information. We want to make sure that the APTC calculations, the CSR calculations, and those were applied correctly to the individual's accounts. And then we also want to make sure that the data that will be reported to CMS and the IRS will be correct. We're looking at doing this, again, very quickly within the next 2 months. So the staff coming in will probably be pretty hefty on these. And the plan is that they would come in, they'd bring a couple of people. They have about 10 days to do an assessment, a quick assessment, work with Xerox, look at the information, and then we'll probably go back and do a refinement of that work order to make sure that they actually have the proper resources to come in and get this work done. So we are currently, like I said, engaged also with Xerox Management. They've agreed that they can use the help. They've agreed to provide the information, provide access to all of this information. I'm sure the carriers will work with us on this, and because they are also very anxious to get all of the reconciliations done. One last note that was kind of a file that just happened today. One of our navigator entities, the Ramirez Group. So right now, open enrollment is over, special enrollment is over. He's got a group of navigators and assisters, I should say, that we're looking really, is there anything they can do for us? What can they do to help us? So I wanted you also to know that we are bringing in about 15 of those assisters into the call center and into the exchange offices, and they will be helping us. We will be able to get them to, these are very knowledgeable people. They've gone with us now for the last year, and they can help us answer those emails. They can help us get through some of those constituent problems, some of those issues. So we will be also utilizing that resource. And I'll be reaching out, now that we've done that with one of our entities, I'll be reaching out to the other two. If they have staff that aren't out there particularly working with the public, this is a really good opportunity for us to bring them in and put them to work.
And Mr. Bruce, aren't we paying for them through this down period waiting for the next enrollment? So
Absolutely.
we're using resources that we're already
paying for.
Yes.
I have a couple of questions. I'm not clear on the scope of this. Are these different vendors to help with individual account resolution or with system issues?
It's both.
And who's gonna do what and who's directing the vendors and who are they reporting to so that they're not working on the same thing, they're not stepping on each other, that Xerox knows who they're helping?
So the way that so far with, especially with the one quote that I received, it was a group of individuals that would be each assigned to a slightly different work stream to start doing that review. And once the 10 days goes by, we get a good look at what we're doing. Then we would have a more detailed scope of work on how we're going to get through the rest of the time period and who's going to what, who will be assigned to which carriers, who will be assigned to which workers. As you know, Xerox has a finance team, Xerox has a billing team, and we will make sure that the bidder is spread out amongst there to the best effect so that we can tackle the problem the best way we can. I can't tell you exactly how that's going to be until they get here and we look at it. This will not be a Xerox overview. They're not going to be influencing them. They will be directed by the exchange, but they will be helping them access the information.
I'm still not clear. Okay. Is each vendor going to do their own assessment?
Is each vendor, so one vendor will get an award of this work order.
Okay.
To do all of this work. I'm sorry.
Okay.
So we'll get quotes from the different vendors and then we choose one vendor to go forward with. One vendor comes in to do this work.
All right. Now on the system corrections, not all of these have technical staff, so we would be asking Xerox to make the correction.
We will be asking Xerox to make the correction. That's why we need to work with the Xerox team. If we need a developer to actually go in and make a change, or we need to decide that a manual change needs to be made versus work in the processes, versus the development of more of the automatic processes, such as QOEs that we talked about earlier. At this point, we know that we still can't add a family member to a plan. At this point, we are doing those manually because we can't get through the process automatically within the system. So the vendor, one of the requests, one of the asks is for them to help us put together a better process so that we can implement that within Xerox so that they can get through it and track it better.
And Ms. Johnstone, I've been working with staff and, discussing with the governor's office. Part of the concern that everyone has is that this reconciliation process is taking way too long. And it puts the carriers at risk and the enrollees at risk as well. And we asked staff to see what we could do to supplement those things at Xerox. I don't see them being the technical IT people at all. I see them trying to figure out or help reconcile those suspense accounts that are sitting in their Great Plains Financial. You received this much, your APT should have been this much, and getting that reconciliation done, and then Xerox has to do any technical fix on it. But I'm not questioning the need for this at all. I just could not tell from the staff report what the scope was, what the process was. First of all, the title says Public Health Foundation, which isn't one of the vendors that we listed.
You're right. So I think that my involvement in this process just started this week. I think that our executive director was unaware that we had 3 contracts in place to do work orders, and he was speaking with the Public Health Foundation to do this work for us through a bit of a state contract. And I apologize that I didn't go back in and change the title of the report. He was not under the impression that we had these resources at hand. So when I pointed that out to him, that's why I just sent this out on Monday, and this is kind of a late-breaking report.
Well, I'll just be curious to see what you come back with, and hopefully it's described a bit better. We already have the existing contracts. This is noticed as a possible action item. So this is just utilizing current funds that we have authority for. Although I think there's some confusion on the description of it, the policy of itself to get the reconciliation done in a more speedy fashion. Everybody wants to see. So
Sounds great.
and I'll make one more comment and then I'll be quiet. Identifying the outstanding reconciling item is one thing, but then the next file that's created can have the same problem. So I've just not seen, it'll help some, but I just am missing how it's going to fix it.
You're absolutely right. The reconciliation happens as of a certain date, and you get a file that is reconciled to that date. Part of the specific services that are listed here are processing payment as well.
But they're not doing the work. We're waiting for Xerox to do the work. We've been waiting for 18 months for Xerox to do the work. So,
And recommendations on, especially because we're going into a manual process, and helping us to provide Xerox with recommendations about how to streamline this, how to move forward with a manual process and keep it reconciled is what I believe here.
well, and the other thing is, and you're correct about new files that are created. Hopefully, we're not going to have a huge influx of qualifying life events. But if the files, if the APTC is calculated wrong out of the system, the next monthly payment's gonna have the same error on it.
Right.
It will be recovered.
And I think the APTC on a go forward month to month is correct now. It's the original January, February ones that are off, that they're being reconciled. So on a go forward basis, I think staff is comfortable that the APTC calculation is now correct.
I'd be curious to hear that from the carriers as well. Or if they're getting the payments that match the original plan.
Any other questions? That's right. Oh, I'm sorry, Dr. Jamison. Go ahead, please.
If we're done with this part, I apologize on part 6 of the agenda, when you brought up the qualified life events, and we didn't have any kind of numbers or breakdown of that. I was wondering if in future we could.
Okay, why don't you bring that up again under agenda item number 11, where we can ask for additional information? Thank you.
This is Marie Kerr. Shauna,
Yes,
I appreciate that staff is taking steps to move forward with resolving billing issues. And from my perspective, I really do appreciate your efforts. I thank you for finding this option, and move forward expeditiously is my thought on it. Let's resolve those billing issues as quickly as possible.
thank you. Do we have any other questions and comments before I see if there's a motion to approve? All right, is there a motion to approve?
Madam Chair,
I'm sorry.
we're not doing anything close to what the agenda is, so I'm not sure about that.
Mr. Belcourt, help us here, please.
Madam Chair, Dennis Belfort.
You don't need any.
Chair. The agenda item was agendized as an action item in case the board wanted to comment on this particular potential action, and it sounds like that the board is looking at a different direction. I recommend not taking action on an item that's not agendized properly. I think I would note that the reason it was agendized as an action item was in case the board wanted to take action. If the board views that staff has existing authority, then it needn't take any action at all, and just and let things proceed as they will.
Okay. No, and the staff definitely has the authority to utilize the funds that have been approved already. The authority's there. I think secondly, that Mr. Fisher wanted to make sure that the board is aware of what he's doing to help move through this area so that the board's fully knowledgeable of how he's trying to get the reconciliations done more quickly.
Madam Chair,
Yes.
thank you for the record, Romaine Gilliland. Just a question, if the executive director, Steve Fisher, chooses to move forward with the Nevada Public Health Foundation as an option, am I hearing that the actions taken would allow him to do that, or is it limited to just reading it? Shauna had identified CSG, PCG, and ignore.
So Shauna, just for the record, at this point in time, if we were to go forward with the Nevada Public Health Foundation, it would be delayed because we don't currently have authority in our budget to do that. We don't currently have authority in our grants to do that. Which is why we went down the path of our current authority with our current contracts. So I believe that if we are going to contract with a separate entity outside of our current entities, while the agreement between the board and the executive director allows the executive director to do so, we would definitely bring that back to the board, at least as an information item.
Madam Chair, does that mean, did I hear a yes, that if Mr. Fisher felt that there was adequate authority to use Nevada Public Health Foundation through whatever means, that yes, in fact, he could go forward and it would come back at a later date as an information item? Is that what I heard?
Yes, I'm sorry, yes, that was what you heard.
Thank you.
Okay, sorry, I thought you were asking about. Okay, thanks.
Whoever will answer.
All right. All right, so this will come back at some point telling us what direction we went at the end of the day, but we're moving quickly on this so we get this done. Okay.
We will let you know at the next board meeting what happens and provide a specific scope of work.
Okay. All right. Let's close agenda item number 7 and move on to agenda item number 8, which is marketing report and awareness survey results. And who is going to make that presentation?
Madam Chair, for the record, CJ Bowden. I'd like to introduce Stephanie Cruz of KPS 3 here in Northern Nevada, and then joining you in Southern Nevada will be Katie Coleman and Jeremy Aguero of Applied Analytics. We'll be presenting today on the survey that was put together to measure awareness generated by the campaign, as well as lessons learned and final metrics out of our first advertising campaign, giving us information moving on to the second advertising campaign and the planning work that we're doing now. With that, I'd be happy to turn it over to Stephanie Cruz.
Good afternoon, everyone. This is Stephanie Cruz, for the record, President of KPS3 Marketing. Thank you for the opportunity to give an update this afternoon. What we're going to cover today is the 2013 enrollment campaign highlights and some insights on both marketing and outreach. And then Jeremy will be covering the post-campaign awareness survey results. And don't let the number of pages scare you. He's not going to go over every single page and take a minute per page. And then we'll have a few comments on our planning thus far for the next enrollment period, which opens on November 15th. So we have been already meeting and starting to talk about it, and we have a plan starting to be formalized so that we will be ready when open enrollment hits. So with that, I'd like to kind of get started with some great news. Everybody needs some great news every once in a while. The good news about the campaign is that the messaging and the media mix approaches contributed to driving 20+ million web visitors, 2 million unique visitors, and 275,000 plus callers to the call center, and helping to fill assister and broker appointments. The media campaign exceeded the projected goals in every measurement category that we had. Our final reach exceeded our goal. Our final reach was 92.2%, 26%. The final frequency exceeded our goal as well. The final total number of impressions, 318 million impressions. We had a 125 million goal. The final click-through rate, again, exceeded industry standards by a long shot. And I think what was really telling was our YouTube click-through rate and our Pandora click-through rate. Those were the channels that we really used later in the campaign to try to target our young invincibles, and they watched a lot of video. Moving on to more good news, we were fortunate. We have a very assertive negotiator for our media buyer, and she was able to negotiate an additional $827,637 in added media value. That was validated through the media. That is not just a number that we calculated. This through the media that qualified as free airtime, additional free ad space, and editorial coverage and events that were negotiated for free. So the added value that we negotiated was an additional 23% of the total media buy, bringing it to a total media value of $4.5 million. The person-to-person outreach approach garnered 1.6 million touch points with members of our target audience. We'll talk a little bit more in detail about that in a few minutes. But again, that was a 87 cents per cost per touch, which is a very, very good cost to have a high quality interaction with a member of our target audience. And with that, I'll throw it over to Katie.
Great. Katie Coleman, for the record, with KPS3 Marketing. So I want to talk a little bit about how the media was implemented and executed and strategized, and then get into some insights, what we believe worked, what we really want to think about as we move into this next session. So the media buy was implemented to effectively deliver the message to our target audiences, with those focuses on young families, young invincibles, and the sick and worried, if we can remember our 3 segments that we developed our messaging around. So our strategy was to purchase mass media that reached the majority of our target audiences instead of purchasing various singular channels. So that we wanted to avoid reaching this one narrow audience and really ensure that we were reaching our targets. The media plan was developed and implemented to achieve the greatest reach and frequency. So how many people we reached among our targets, and also how many times we talked to them. And that all happened within the budget. So that's our goal. That's kind of the trifecta there. So our strategic media mix focused on reaching our audiences through a multi-contact approach. And the multi-contact approach is really what leads to that larger conversation and the multiple touch points among our target audience. So we all know network television and cable television was a big part of our buy. It was actually 51% of our budget, And this was allocated to this medium because of its power to reach our target audiences. I'm just gonna talk a little bit about some of the programming that we placed on. And again, that's for us to continue to think what worked, what didn't, and what we need to plan for moving forward. So certainly the ABC, NBC, CBS, and Fox affiliates, both in the North and the South. And then we kind of honed in on those segments. So Cartoon Network, MTV, VH1, ABC Family, Animal Planet, Adult Swim, Nickelodeon, Comedy Central, and BET. Those are some examples of how we kind of focused in on our segments. And then certainly thinking about our Hispanic population, Univision, Entervision, Azteca America, and Telemundo were purchased as well. Radio was also purchased based on ratings and how effectively we can reach those audiences. Out of home, this includes our billboards, our various types of public transportation related ads, bus wraps inside the buses, inside the bus waiting stations, and that was
Yep.
It's a dramatic pause.
Pause for effect. If you can hear us in the south, we've lost you completely, so hold on with us just a minute. Sean is. Appears to be an IT issue.
I think KPS3 broke it. We will backbill accordingly. That's awesome.
That's really good.
Control system is disconnected.
This will be fun.
We should take.
Go check your servers.
Yeah.
Or 10.
Can you get through?
Should have them memorized, 'cause
Yeah. Oh, okay, so it's for the state. Okay, well. Okay. All right, so maybe like a 5-minute break. Well, let's start with 5. All right, thanks, Barbara. All right, we're gonna take a 5-minute break, and it's the state phone systems are down, so we'll take a 5-minute break. It's everybody, it's not just everybody. 5-minute break, we'll start with that. Hopefully we'll reconvene in 5 minutes with phone systems up and running.
is it the World Cup, you know?
Yeah.
It's
Yeah,
exactly.
exactly.
All we hear is goal.
I thought it was just us again.
Straight down.
What Lisa gives you, David, at 20 minutes.
Get there.
Get there.
That's true, maybe.
Maybe he did it on purpose.
CJ, are they gonna do an APTC audit, because it's not due for the IRS, this year it's on a requirement to audit those APTCs. Are the insurance companies planning on doing it along with the exchange, even though it's not a mandate of the IRS this year?
That would be a great question for the board. And for Laura Rich, yes.
Okay, well, I just don't know if they, I've seen agenda items where they're planning on it, and I didn't know why, but, you know, if it's something that's not mandated this year by the IRS.
Well, the audit was put in place, or we've done independent audits to make sure that the system's functioning correctly.
Well, that's a great
To
idea,
make sure
but
that
I'm just
individuals
wondering
don't
if they're actually
face
gonna
the extended bill.
report it, because initially there isn't a reconciliation required this year from the IRS for the APTC.
For individuals, there's.
For even the insurance companies. This year there isn't a requirement for the insurance company and the exchange to report to the IRS. Now, the individuals.
We have to report on the, what's it called? The Form 1095.
Yeah, but this year, I'll send you over, but it's not. In our correspondence, it's not.
We haven't gotten federal regulation. The federal regulation's still in CMS on a daily basis, making sure we'll have a 1095 process up and running to report to the IRS by January 31st of 2015. We just got the phone 2 days ago.
The correspondence we have says that it's not a requirement of the insurance company or the IRS for sure.
IRS is telling us absolutely it's a requirement, it's going to be forced, and individuals will have to reconcile all of theirs as their final taxes coming through.
For this current year?
Absolutely.
Okay, because we have documentation that's in.
That's someone.
That's.
When did it come out? Because.
I'd have to look at it.
Yeah, just.
Because we were just wondering if they, you know, if they were going to, because everything we saw, it looked like they were going to, and there wasn't a requirement.
We are, and we've been told it is a requirement. And.
Well, I'll pull our documentation and send it through that.
Or the 1095 documentation, sending out 1095s, that's still a go, correct?
I'm sorry, repeat that?
The 1095 APTC reconciliation, that's still a go 100%.
What's going on? You guys called
Correct?
It's still go, yes.
Yep. So.
Okay, because that, the carriers is said in our documentation, it's not a requirement this year.
They are.
Then you realized there was a lot of food in the fridge.
Well, I went, really? I'll send you over our first one.
Good.
Because that's what we.
Excellent.
Because
You
we've
didn't
been
do it on
all
the grill,
along,
did you?
this is incorrect, what is the hammer that's gonna be used?
The pool guy?
But, you know, I'm trying to
Oh,
constantly
that's, that
figure
dude,
this out,
I guess he
you know,
just
and it was
shows up
always,
at random.
you know, depending on the.
And then what do you?
Federal poverty level, the maximums are already been out there, what they're
Okay,
putting out
good.
there.
Exactly.
Fine would be
Yeah,
not too
he
much,
kind of
not
didn't
good
schedule.
enough, et cetera.
Okay,
It's
good, you handled that well.
Under it's 2,500.
And we're still going here.
And then it says
I
it
imagine we'll
doesn't
be done in
require
about 3
either
years.
the insurance company or
But,
the exchange to report.
you know where to reach mom, right?
So I'll
Oh, by the way,
pull it
I
down.
don't have my phone in front of me,
I
so.
must be
your target audience.
Yes, we have reached me by email.
Definitely, then I went on a break, so I've
If
been.
you need to get in touch with me, okay?
A little break.
Okay, because we're pulling off, because that's what half our business is tax, so we've been just pulling, you know, whatever we can, because we've been kind of shooting the dark, anything we can get these hands on, or, you know. And it's
You got
not
it.
very.
You got it working.
Definitely there.
Okay, well, then I'll send it over to him, and then can pass on to our clients today.
Yeah, both of you.
Right, wrong, or indifferent.
Both of you get out there and pick up
Yeah.
dog checks.
But there it is, yeah, because I was wondering about that, because I saw that, and I thought, yeah, maybe they're just trying to do a trial run on it. just to make
Okay.
sure.
Okay, cool. Thank you, Mickey. Nice of you.
Hi,
Peter.
You're back, yes.
Okay, I'm here. I'm listening. Oh, he said no. No.
Hi, Stephanie, can you hear us?
Yes, we can hear
I'm
you.
gonna be back on the
Yes.
record. so I don't- Okay, bye.
All right. You remember exactly where you were? I do. Okay. I wanted you to back up about 60 seconds. I sure will. And we'll go back on the record, and this is our report on, from KPS 3, and Mr. Tuero's here to help us do the survey. So, Katie Coleman from Record with KPS 3 Marketing. So I'm gonna go back to out of home-ish area. Okay.
We talked about out of home being placed, which offers us that constant exposure, the high reach, and the opportunities to reach people where they work and live. We call that geo-targeting. And I mentioned that the majority of the budget was allocated to Clark County due to the high number of commuters, and also because Northern Nevada outlets were more willing to give us some bonus boards, we were able to adjust and purchase some more transit for Southern Nevada to compensate for that. I was getting into digital, and digital was about 12% of the budget, and digital was a really great opportunity for us from a media standpoint, because what digital does is it provides us the ability to pinpoint, especially regarding our uninsured and Hispanic audiences. Digital really offered us the ability to hone in on them and really serve up those messages on the websites that these people visit. We can also track performance in real time in digital, so if we see that something's performing better than another message, for example, or if we know a certain approach or tactic in the digital space is working better than the other, we get those results almost in real time, and we can make adjustments, which is exactly what we did with this campaign. And then print. Print was a small portion of the budget, but it was an important piece to reaching our rural areas and also our Hispanic markets. So that's kind of a recap of what we did as far as media mix. We also certainly took into account our demographics, geographic, and the phases of the campaign into how we structured our media buy. We divvied up the media by 70-30 split among English language outlets and then Spanish language outlets to align to our state demographics, and then geography as well, allocating about 72% of the budget to the southern part of the state, and then the remaining 28% to both Northern Nevada and those rural areas throughout the state. And so, real important part, the insights. What did we learn? What are we kind of thinking about as we know what we did and moving forward into the next campaign? So we're going to be exploring a similar mixed media approach. We know that mixed media approach works to reach our target audiences through paid placement. We're also going to need to take into consideration the new format for the exchange. We know the messaging is going to be critical in reaching these target audiences, knowing there are some changes as to how people are going to actually enroll. We know broadcast, namely television, is a key component. It will continue to be a key component because of its reach, but also it uses sight, it uses sound to inform our audiences about a fairly complex topic, which we know will continue to be a nice story to tell. And out of home will also be explored, but we'll also be taking into account the fact that we have some awareness going on now, right? And the main purpose of out of home is drug awareness. And it isn't really ideal for explaining complex concepts because we don't have a lot of space. So we're going to evaluate this channel among all of the others and make sure that we're setting up the best canvases to explain this upcoming enrollment cycle, the format change, and those sorts of things. Again, we believe strongly in the power of digital. It was evidenced by the high click-through rates. We drove a lot of traffic to the site because we were able to talk to these very specific people where they're at on the internet. It was one of the drivers being able to be very specific and driving them to the actual product, to the actual web portal is very powerful, and we recommend that we continue to use that tactic. And then again, we know that print provided us an effective channel to reach rural audiences, Spanish-speaking audiences, and it also gives us a longer canvas to tell our story. So we like to keep that in mind, and we will continue to evaluate that as we move forward. And with that, I'm going to toss it back to Stephanie, and she's going to talk about campaign highlights and insights relating to our outreach campaign.
Our outreach campaign, again, Stephanie Cruz for the record, our outreach campaign really took an individual, most of the time, approach to communicating and engaging our target audience. Our research prior to implementing the outreach program indicated that outreach, person-to-person communication, was going to be critical with this particular topic because it was sensitive, it was complex. People would have questions that they wanted to have a conversation in private, and so it was really important to have a good outreach program. We formalized the program and began it in April of 2013. almost immediately after we had a brand name. And so our outreach team really hit the ground running as early as April 13. Prior to the assisters and the navigators being designated, they really started to lay the groundwork and were then joined by the assisters. We reached tens of thousands of our target audience at events, everything from health fairs and immunization fairs to Cinco de Mayo, to soccer games, to malls, to movie theaters, a lot of presentations. There was high interest in this topic, of course, prior to open enrollment, and we had a lot of opportunities to make presentations in both English and Spanish. We had a massive literature distribution network between nonprofits, government entities, everywhere from churches to the DMV to stores. I mean, there was a lot of literature that was being distributed. We really partnered with schools, churches, and did what we call the Tupperware party version of outreach, where we had in-home meetings similar to a political campaign where you have at-home coffees and you meet the candidate. This is where we had some of our outreach staff and experts in homes and having conversations with small groups of people who then hosted other people in their homes so that people could really have an intimate experience. And then finally, we did our door-to-door canvassing. It was effective at reaching a lot of our target audience. We really focused predominantly in Southern Nevada on that program. But again, it reached many, many people. If they weren't home, they received a piece of literature, a door hanger. So again, even if they were not home to have a conversation and answer questions, they really were able to have the information distributed. So some highlights and some insights. Again, we really felt that our outreach team was able to develop a trust relationship with a lot of people. As the campaign wore on, they also became a sounding board and basically really trying to help people individually as people encountered issues. We focused on activities specifically to reach the uninsured in our target audiences, the clusters specifically. Partnering with the assister organizations was an incredibly valuable partnership. Our goal, ultimate goal, was to make a referral to somebody who could actually sit down with somebody and help them through the enrollment process. It worked very well because those eyeball-to-eyeball situations, it fostered understanding. We could really explain complex situations and really encourage people to act. And it created the ability to have a two-way conversation, which even though mass media can reach a lot of people, at one time, it doesn't allow that conversation, and so that was really important part of outreach, and I think any navigator or assister would probably echo that sentiment. So some insights and highlights, what we're recommending. Outreach should definitely continue to be part of our efforts moving forward. It should have an outreach component of the campaign as well as the multimedia campaign. Our tracking tools can help us identify which events and activities were more impactful last year. We have a full book of activities and touch points and all kinds of metrics that we took into account, and I think we can make some good decisions for outreach going forward. One-on-one conversations and referrals to assisters were tracked. Again, that was our ultimate goal, to gauge the value of engagement. And I think probably our top insight and recommendation, the enrollment events that took place later toward the end of open enrollment were, I think, very effective. It was certainly an urgency close. People had an incentive to try to get enrolled if they had not yet enrolled. But it is a good forum, and we believe strongly that that should be part of our program going forward. More enrollment events, different type of enrollment events, really reaching into our target audience. And then we were very successful in being able to leverage our media relationships. We got a lot of coverage on the enrollment events, and we think we continue to do that next year. And again, while the door-to-door canvassing was great in increasing awareness the first year, we don't think that that's going to be a part of our plan going forward. We really want to focus on the enrollment events. So with that, I'm going to turn it over to Jeremy, who is going to talk us through the post-campaign awareness survey and the results and what they mean.
With your permission. Thank you. Appreciate the opportunity to be here. I was asked to come briefly give you an overview of the survey that we did, the post-campaign survey. I believe it's been distributed to everyone. I didn't know it's been distributed. I brought some extra copies. I don't know if folks are like me and like to look through hard copies. If for any reason we don't have them, I've got an extra one. I'm happy to share them with anyone that's here. Oh, thank you so much.
It is. It's happening. Do you want
No, I have one. Are you welcome to them? Just saw two hands.
You know, I think that,
Everybody else is okay? Terrific. There's a number of slides here Stephanie alluded to. I will not be trying to go over each slide in excruciating detail. And this is the summary version. A longer version will be forthcoming with all the details of the survey that we did. I will let you know when I'm changing pages. If you'd like to follow along, that's great. Certainly, if you'd just like to, kind of get the gist, I'll try and focus on that as well. I'll jump down to the page that's entitled Project Overview. What is it that we were asked to do here? Essentially, the goal here was to try and survey folks in three specific groups. Number one is the overall population. You'll remember when we did the pre-campaign survey, we really looked at the aggregate population and tried to understand what they knew, what they didn't know, that kind of thing. There was a request, at least some comments that we got back. We needed to really kind of focus on two target groups in this post-campaign survey. The second being those that are currently uninsured, and the third being these young invincibles that are uninsured. And so we got together with KPS3 and some of the folks on the board and really tried to come up with a new strategy to do that. And so two things are really different. Number one is the approach that we took, and I'll talk about that a little bit. And the second is not only did we get this general population to see how much the needle has moved, if you will, but also really focusing in on those other populations. Again, we have tried in all ways to try to avoid bias, but some of that is always going to surface. We should always kind of try to keep a little bit of that in the back of our mind in terms of that approach. At the end of the day, we think we have a very reasonable look at not only the overall population, but certainly those primary populations that we're focused on. In order to participate in the survey, someone had to be a full-time resident of the state of Nevada. They had to be between 18 and 64 years of age. We excluded anyone that worked for the media, those type of things, and we included only people that made between 138 and 400% of the federal poverty level, as determined by household size. Again, those are all standard screeners that we have a tendency to use. So those are the survey parameters page. I'm going to jump on to the next one here that goes specifically to some of the specifics in that those parameters. We were in the field from June 9th through July 3rd. I'll be honest with you, the survey took us more time than we expected, and I'll talk a little bit about that more as we go through. One of the conversations we had in setting this up was our concern as analysts that the population that we were trying to survey was much smaller than I think we had thought in the past that it was. And I think that very much turned out to be true, and I'll talk a little bit more about that as we go. The survey was conducted in both English and in Spanish. I will tell you that the number of Hispanic respondents, certainly the first survey, the pre-campaign survey, was also surveyed in that way. But the number in the targeted groups that were conducted in Spanish was substantial relative to the general population. As a matter of fact, with 30% of the overall population identified themselves as Latino or Hispanic, those were either the young insured or the uninsured, were 2/3 of the people that responded. It was very, very substantial. I'll talk more about that as we go through. The margin of error for the general population was roughly 4.8%, the uninsured population 4.9%, and for those 18 to 33, the uninsured population was roughly 5.8%. We can talk more about why those percentages exist if we need to as we go through, but it has everything to do with the number of people that responded. On the next slide, there's a set of Venn diagrams. As we're going through this, actually there's just one Venn diagram, there's not a set of Venn diagrams. There's one on there. And as we go through, I think it's important to understand what we're going to be seeing as we talk through this. And that is to say that the general population is a universe of folks. Some of them are insured, some of them are uninsured. Some of them are between 18 and 33 years old, some of them aren't. So what we did was we surveyed everyone, but we tried to oversample those populations that were within this target. And we'll talk a little bit more of that as we go through, but we need to keep in the back of our mind, and I appreciate it if you think through it as I'm speaking, in that those populations are not necessarily mutually exclusive. When I'm talking about the general population, we just survey anybody that would talk to us that fell into those classifications. When we talk about the uninsured population, some of those will also be counted in that general population because there are folks among the general population that are also uninsured. On the next slide, we talk about survey locations, and I would say that the most significant difference between what we did last time and what we did this time is the approach that we took. The vast majority of the surveys that we undertook were one-on-one interviews at the locations that you're seeing. UNLV, the College of Southern Nevada, health centers, bus stops, north and south, grocery stores, things like that, that they would allow us to be out there and have interviewers that would essentially intercept someone, ask, are you willing to take this survey? And then we'd go through the series of screeners that we had. I will tell you that we had to intercept roughly 11 people for every one that made it through our screener process. This is not just talking about people that said, sure, I'm willing to stop and take the survey, but we screened out better than 90% of the folks that we talked to just from those screeners. It tells us about the aggregate size of the population. Heading here, we sort of jump into the key findings, and perhaps I can begin where I will end the survey here. If there was any doubt whatsoever in terms of the ability to make progress between a year ago, a little more than a year ago, I guess, when we did the first survey and where we are now, I think it's relatively clear. And there are two statistics that jump out at me. One I have at the top of this page, one I will talk about when I end. That one is when we ask people, does the state of Nevada have a health insurance exchange? They have a website where you can go to purchase health insurance. Only 11.5% of the population pre-campaign needs, right? And if we look at the post-campaign survey, that number jumps all the way up to 54% of the population. From an analyst perspective, and I do this from time to time, I can tell you that is relatively significant. Now, this is a complex issue, right? I mean, there's no doubt about it. And now we always have to keep in the back of our mind, you know, these somewhat frightening statistics. If we just ask people who the president of the United States is, or who the vice president is, the remarkable amount of people that don't know. I mean, and that's okay. I'm not trying to sound pejorative by any stretch of the imagination, but with an issue that's this complex, I did not expect, from an analyst perspective, for it to be quite as big a jump. I mean, that's almost fivefold in terms of the people that knew there was a place to go. Now, when I get to the end, I would tell you that I think that there's a second statistic that's even more compelling than this one. And that is when we talk to those that are uninsured, and we talk to the young invincibles, as you all refer to them, better than 80%, better than 4 out of every 5 indicated that they would go to the health exchange. They would go to Nevada Health, let me just say it that way, in order to buy health insurance. Again, 80% or higher, even among some of the young folks. And so when we think of HealthLink, when we think about a health insurance exchange, those are pretty meaningful to me. The second one is that there are moderate unaided awareness. And that is to say, we ask two sets of questions. One, does Nevada have this? Some people say yes, some people say no. And then we inform them. We ask them, do you know the name of it? Right? We wanted to know, do you know the specific name? And of course, there's a drop off from there. And then we ask them, we're going to tell you the name of it. Is this the first time you've heard this name, or do you believe that you've heard it before? If we think about that unaided, unprompted, if you want to think in awareness, the general population was about 56%, the uninsured population 62%, and those 18 to 33, which always are going to be a little bit less no matter which set of statistics we talk about, was about 51% overall. Again, we were relatively impressed in terms of those particular numbers. Continuing some of these key findings, the one on the top of the next page deals specifically with Hispanics. And I was surprised, I don't think is a strong enough word, relative to the concentration of the population that responded, that was uninsured, that identified themselves as Latino or Hispanic. Certainly we knew that those numbers would come in higher. We expected that from the first set of analyses that we did, but double, a 2 times rate, 2 times incidence, if you will, among those populations was substantial. As I alluded to before, it's not that people don't know that the Affordable Care Act exists or that the exchange is there. Certainly we have room to improve, but it's not as though they don't know. The barrier is largely cost. We saw that in the last one we did. We certainly saw it in this one. Cost was absolutely, unequivocally the decisive factor as to why all segments of the population found themselves to be uninsured. The third page, in terms of the key findings, is that eligibility is stronger among, belief in Nevada HealthLink eligibility is stronger among the target populations. That is to say, the reach is greater to uninsured and young invincibles, which we found to be somewhat impressive. And the likelihood of purchasing insurance through Nevada HealthLink was high among those target populations. We'll talk more about that as we go through, but nonetheless, those were there as well. And again, very impressive in terms of the change that we saw over the last go. So with that, I'm now going to transition into the survey results. There's a little tab that says survey results. And again, respecting the time, I'm going to go through these relatively quickly. I tend to talk quickly. I apologize for that as well. And you'll certainly stop me if there's anything that you want to talk about in more detail. I will help. The first slide here is, do you currently have health insurance? And we were very impressed by this particular statistic because it matched very closely the percentage of the population that we know doesn't have health insurance. So again, this gives us a really good feeling that although we were targeting these areas among folks that we were hoping would be uninsured, that's where we were going to get them, we found that the overall population was relatively strong. On the next page, when we do a cross-tab relative to do you have health insurance, and this is just one I wanted to point out, there are many that we could point out here. But if we ask this question among folks that identify themselves as white or African American or Latino or Hispanic or something else, you'll see this huge bump in the amount that I've highlighted there for you with a red box. That say no among the Hispanic and Latino population. I'm probably overstating something that I've already mentioned, and I'll probably do that one or two times more as we go through, but it really was relatively compelling. The slide that comes next is Medicaid eligible recipients statewide. And frankly, this is not what you hired us to do, but nonetheless, as we were compiling other statistics, we were impressed by the fact that this number has increased so rapidly, 54% over the past 12 months if we compare May to May. Of course, that is relatively dramatic. And we also have to understand that that is shrinking the share of the population that is going to respond to our survey because we are specifically screening out these folks. And you can see how sharply it has really increased. Of course, that's a matter of policy at the state level that's resulting in that, but nonetheless one that's important. There's one more slide in this sort of vein, if you will, and that is eligibility for coverage as of 2014 among currently uninsured Nevadans. Currently uninsured Nevadans is estimated by the Kaiser Health Family Foundation, as well as using the current population surveys and some other things that are out there, at about 621,000 people overall. That's the universe of people that are currently uninsured. In this pie chart, I've tried to show for you how many of those actually fall in to the survey population that we were looking at, right? So we have to take out the folks that are Medicaid eligible, the folks that can participate in CHIP, we all know those. The ones that are currently unsubsidized, that exceed the threshold for income, that we had in there, the 138 to 400, they're essentially above that particular number. And then there's also one that I think is often not thought of, and that is ineligible due to immigration status, right? That is 13% of our uninsured population. And when we started asking people questions, why don't you have insurance? Why haven't you gone to exchange? A remarkable number of people said, I'm waiting to become a resident so that I can do it, which was surprising to me. And so another reason we want to have this here. You'll notice that the little, and I'm colorblind, so you'll forgive me, that kind of looks like gray, like a dark color gray to me, but I don't know if that's exactly the color that it is. At the top there is the one that says eligible for tax credits. This is essentially our population. So we're talking about 22% of the population, and we're taking 20% of that, right, in order to, that's who essentially we were surveying, right? It is a fraction of the state of Nevada's population that we're actually targeting here, and I wanted to make sure that when we're thinking about that, we'll at least have that in the back of our mind as we go through. If I continue on to some of the more focused questions, what is the main reason that you do not have insurance? You can see the general population. Again, it's a fraction of that general population. You see those that are uninsured, and you can see the uninsured 18 to 33. You can also see the overwhelming share of this total that reports that it is too expensive. This is key. We've seen that in national studies. We certainly saw it in the primary one that we did. It is going to be a major hurdle that you're going to have, from an analyst perspective. We would expect that to be a significant hurdle. On the next page, you'll see a little breakout for those that are 18 to 33. Again, your invincibles. I just wanted to highlight here those that say, I just don't need it. Right? Almost 1 out of every 5 essentially saying, I just don't need health insurance. I am invincible, as we like to classify them, which was higher than any other group by a fairly healthy margin. On the next page, there's a chart, and I will apologize in advance for the complexity of this chart. I'm sure any of you that had the time to kind of walk through this, it will be fairly straightforward, but from a presentation standpoint, it is a little bit suboptimal, and I will apologize for that. But what we did was, we asked people a question. Does Nevada have a health exchange? And people would say yes, or they would say no. We then subsequently asked them, can you tell me the name of that? And they would either say yes, or they would say no. And if they said yes, oh yes, I know what that is. Yes, I recall hearing about that. We put them in the pile of people that said, yeah. We're not gonna say that they could remember it unaided, but they did say, yeah, I've heard about that sometime before. And then we have this group of people that I have no idea what you're talking about. And that's a smaller group of folks than it was before, but we need to understand that we kind of went through this decision tree to put them into one group or the other. Those that knew and those that didn't know. And so we'll talk about that a little bit as we go through, and we'll classify them in those groups as we talk through them just a little bit. So in the first one, I'm now flipping to the next page, we're only going to talk for a moment about the people that said, yes, I do know that there's a website in the state of Nevada where I can shop for health insurance. And if we go to the next page, you can see the general population, you can see the insured population, and you can see the uninsured population, and you can see those that are the young invincibles, and you can see the share of the population. Now recall, we didn't get together. When you saw the last of our analyses, this number was, roughly 11 out of every 100. It was a relatively small number. So while we still have some work to do, there's no doubt about it in terms of folks that couldn't tell us, that didn't know about it. The progress has been relatively remarkable in just 1 year's time. If we jump down to the general population, again, that sort of comparative set from what we had last time, again, 54%. If we look at the awareness among young invincibles or the uninsured, those numbers were about 50% and 40.5% overall. Continuing to the next of our slide, what is the name of that website? Right? When we asked, again, this is among only those people that said that. Right? We want them to be able to know the name of the site. That's the recognition that we're avidly going for. But impressively, look at the number that are uninsured on our chart here that we're able to say that. That's roughly 6 in every 10, which if we jump to the next slide, that's essentially what it's going to say. But this universe of uninsured is actually higher than the general population, which would at least suggest that the targeting has been relatively effective among, again, that small sliver of folks that we're considering this target population. If I continue to the next set of slides, we then ask the question, do you recall hearing or seeing anything about Nevada Health Link before today? And this is among those who said Nevada has a health insurance website but couldn't give it the name correctly. And you'll notice that 60.5%, let's call it 61% of the uninsured population indicated that yes, I've heard about it even before today. So again, it's resonating with them. Sometimes we have to remind them about it, but they're getting it in a fairly healthy way. I'm going to jump down then to slide 26 and then slide 27, which is our other one on our little tree diagram. And now we're talking about the people that said, nope, I never heard about this before, or they said, no, Nevada doesn't have a website where I can go buy it. And of course, that's a much smaller share. If we go to the next slide, you'll see the percentage that are saying, no, it just doesn't exist. A lot of them said, I don't know, I'm not really sure, that kind of thing. But only about 14, if we think about it that way, again, those that are out there, the ones that said, yes, I've heard about it before, once we tell them the name, actually increased it by about 14%. For those that said no, they're hearing about it for their first time, again, these are people who said, no, I don't think we have it. That's about 81% of the uninsured, and relatively close in terms of our other two subpopulations. When we get into it, among those who are aware, okay, so now we're coming back full circle again to those that are aware. Those that either said, yes, we have it, yes, I can name it, no, I can't name it, but one, now that you tell me what it is, I do recall hearing some things about it. Or if no, we don't have a website where we can get it, but we tell them the name, yeah, I have heard about that before, and we start walking through that. We jump to the next page, we ask them more detailed questions. If you want to get more information generally about health, like where would you go first? Not surprisingly, a lot of folks said they go to the Nevada Health Link website. That's a good thing, right? 60% of the general population, 53% of the uninsured population. We always have to keep in the back of our mind, it's a certain share of the population that's not going to go to the internet no matter what we ask them about. You'll also notice the internet
generally was number 2, and it was actually higher among the young invincibles. 20% of young invincibles, roughly 1 in every 5, said, hey, I would just go straight to the magic Google machine, right, and find out where I ultimately needed to go. I thought that was pretty compelling, so I wanted to pop that out for you as well. Jumping to the next of the slides, thinking back for a moment, where or how did you first learn about Nevada Health? Surprisingly, and I was a little bit surprised in our first conversations about it, TV commercials were number 1. Now, a lot of young invincibles out there, a lot of young folks, a lot of social media out there, but that television still really strong overall. You'll notice that number 2 is television in terms of news reports. I would have kind of expected that one to be number 1 up there. Family members, friends, newspaper, all those things that are out there, you can kind of take a look at how those fall out. If we look at the general population, again, 53% said it was either television news or TV commercials, where again, a remarkable amount of the information that we consume as human beings happens still on the television today. The next slide, or I guess 2, if you didn't jump to the one that had the little breakout. So I'm reading the one that says, do you recall hearing or seeing anything recently on Nevada Health Link about the following? Or about Nevada Health Link on the following, and then we read them a series on television, on the internet, on news from newspaper accounts, any of those type of things. And you can get a sense, television was high, internet was also very high, social media was actually a bit higher than I think we would have expected from the overall population. Again, impressive in terms of the number of places that people reported. Jumping to the next slide, of those who were not aware of Nevada Health. Okay, so now we're talking about that smaller share of the population. If you look at our tree, these are the people that are saying, even when you tell me the name, I'm telling you, I have no idea what you're talking about, right? That's the folks that we're going to talk about here briefly for a moment. We asked them, where would you go? Where would you go if you wanted to get more information about this thing called Nevada Health? Internet, number 1, the website, number 2, you'll notice how they flip-flop. That's kind of how I would have expected it before. Interestingly enough, they said state website, which was much lower down. I don't know if that's a disconnect between Nevada Health Link and the state or something along those lines, but that was there. A family member, so they call their doctor, that kind of a thing, which I thought was kind of interesting. Among the uninsured, you do kind of see a spike. The health district and call a doctor or visit a nurse, that kind of a thing, to learn where to go was much higher among the uninsured than it was among the general population overall. When we talk now about eligibility and participation, I'm going to jump through those relatively briefly. Again, now we're talking about the universe of the entire population. Again, do you believe you would be eligible? Do you believe you'd be eligible to purchase health insurance through Nevada Health? And the general population, that number is low. And we would expect that. Some people would say, hey, I already have insurance, I'm not going to be able to do it. But among the uninsured, that's 60% of the population. And among those young invincibles, it's about 55% of the population. When we ask the general population, one thing to keep in mind, that 87 of those people had visited Nevada Health Link, and 15 of those respondents had actually purchased insurance through the website. Right? So we kind of have a moving against us a little bit in that population because we're not counting those kind of either way. If we ask them, what is the main reason, I'm now jumping to the next slide, what is the main reason that you would not be eligible, that you don't think you would be eligible? Overwhelmingly, I can't afford it. 73.4% of the uninsured population said the reason that I can't get it is not because I'm not eligible, that I don't classify, but that I simply cannot afford it. You'll see some of the other answers there, but that is the overwhelming answer among the young and among the uninsured just generally. When we ask the question on the next page, do you believe that you would be eligible for federal programs that would reduce the cost? Now recall, among the uninsured, we are only surveying that sliver that would be in that particular category. You'll notice that among uninsured, 60% of them still said, no, I don't think I would be able. Now, of course, that number's higher than it was before. Now, granted, the uninsured was a smaller share. We have this universe of these folks today, but there's still a pretty healthy share that are saying no, about 30%. But 60% are actually saying in the affirmative, yes. Again, a lot of progress, still a little bit of work to do, which I think is sort of the overarching theme. If there's any slide that I would point you to in terms of progress, it would be the one that follows on the next page. How likely would you be to purchase insurance from Nevada's health insurance website? 83% of the uninsured said they would either be somewhat likely or very likely.
to make that purchase. That is a huge share of that population. Again, 73% of them are saying, I will admit I purchased it, but I can't afford it today. And that's really what the problem is. 90%, roughly 9 in every 10, or just under 9 in every 10 of the young invincibles made that same statement. And again, from my perspective, that's pretty impressive. If we go to the next page, what payment would be, what would be unaffordable to you? When would it no longer be affordable? We essentially read these top down and bottom up to get the answers to that. You'll notice that a very substantial share. If you flip to page 46 or the next slide, I think this is pretty compelling. Less than half of the uninsured population could indicate that they can afford a payment of $100 or higher. I think they're very concerned about that. And you'll notice that the one that really pops out, at least to me, as I'm going through this, is the one that says none of these, right? Even when we got to the lowest level, they said, I can't even afford that. That's 15.2% population. 15 out of every 100 folks is a fairly healthy share. Jumping to the next one, if a person doesn't have health insurance, will they be fined on their federal taxes? About 2/3 of the uninsured knew this was the case. A lot of the general population, but more importantly, focusing on these young invincibles and the uninsured, about 2/3 of them did know it was the case, about a third did not know it's the case. Again, huge progress overall, still a little bit of work to be done. If a person does not have health insurance, will they be fined? If we just kind of look at it in terms of just focusing on those young invincibles, again, they were a little lower than we want. The demographics are there. We can go through the demographics and any level that you want. The only one that I really wanted to point out is the one that's on the second to the last page in your packet. And again, I've said this twice, I'm reading the dead horse, but if there's anything that jumps out at me, it is this particular slide. If we look at the ethnicity distributions on that second to last slide, the general population of all the folks we surveyed, 31%, 32% identified themselves as Hispanic or Latino. Uninsured is 64%, and the young invincibles was 67% of the population responded. To me, that is particularly compelling relative to the demographic that's out there. I apologize if I went long. I tried to cover a lot of information relatively quickly. I am here to answer any questions or provide any other information. Certainly want to thank you for the opportunity to be here, for all the hard work that I know this group has done, and in particular to KPS3 that has been a beacon on the hill, making sure that we head in the right direction.
Mr. Squirrel, thank you very much. Very informative and surprising with some of the statistics. Thank you. Do we have any questions from board members to Mr. Squirrel? Ms. Johnstone? Leslie Johnstone. Cost is obviously a huge factor in trying to get people to actually sign up for health insurance. I wonder, do we have to worry at all about damage control after the negative press that we've got dispersed from here as we head into the next cycle? Did you pick up any of that?
For the record, Jeremy is aware with applied analysis. I mean, the brief answer to your question is no. I mean, we didn't get into the technology side of the process. From having gone through the answers and looking at how people responded, I would say that you've made more progress than you've been hurt. And that is from the standpoint, when I ask someone that's uninsured, would you go to the health exchange and get it? And 8 out of every 10 are saying yes, and 9 out of every 10 are saying young invincibles are saying yes. That to me says that you still have the high ground. I was worried about that, and we talked about that a little bit as we went through. So that's probably all I can share with you in terms of the outcome of our analysis.
Dr. Jameson?
Dr. Jameson, for the record, I'd like to just say excellent report, great presentation, love your thoroughness and your passion, and it is very good information for us. And I wasn't surprised when you said earlier, when you were talking about your insights and how you focus this next year, because we all agreed one of the most exciting things that happened last year was, of course, it was at the end of open enrollment, so everybody was scurrying like everyone waits till the last minute. So it was an overwhelming, successful event that everybody came to, and we had an amazing sign up at that one event. And I think that's an excellent way that everyone's going to work together to focus, as the board had said when we got the results of that, when we were excited. But I was still very curious because when you were saying you might focus on that for future enrollments, but then your door-to-door, you would probably not do again. And I have to admit, when you were rolling that out and talking about it as it was going on, it seemed like a phenomenal, grueling and onerous process. And I don't know, did you do data to show, because it was a lot of people you had out there going door-to-door, and that had to be quite expensive for the door-to-door campaign, how many doors you get, because I remember we heard a lot of data, how many people signed up per touches on door-to-door versus when you had the enrollment and you had people come to the event, because you might not have been able to calculate the number of that, but how many people that talked to someone that did sign up at your enrollment events?
Katie Coleman with KPS 3 for the record. I do not have the conversion rate of how many people let me back up a little bit. So with the door-to-door campaign, there were a couple ways that we touched people. One, we knocked on the door, someone answered the door, and then we conducted an interview, let's say. So there was the actual person-to-person contact. What happened, and I do have the metrics, and I'll circulate them among the board as well again, but the metrics against, how many people we actually talked to face-to-face. How many people that we didn't get at the front door, but we left them information. So the conversion on that engagement, we weren't able to track that specifically, but we did track how many people we referenced to a specific enrollment assister and how many of those people actually ended up calling and making an appointment. And I'll be happy to kind of drill that down into an easy to digest piece of data, but so we do have that information. As far as the enrollment events go, that is also in a previous report. I want to say in the north, we helped facilitate several hundred enrollments that day. We ran into some bandwidth issues with the website towards the end of the day, and then I'll have to look up the actual enrollment figure for the event in the south. But we do have all of that, and we were able to convert that. As far as the door-to-door campaign goes and kind of the tactics there, just to touch on that a little bit, this past enrollment cycle, we were really focused on awareness because we were introducing something that no one knew about. And it was a new product, and so that was really the idea around that, is getting the name out there, getting the website out there, and then diving into that person-to-person contact when it was available in the neighborhoods that we knew we needed to target. This time around, because we know that being able to have that eyeball-to-eyeball conversation, but then say, hey, let's sit down and actually do it, is a real opportunity this time, because we have the awareness where it's at, and now we really want to get them to actually sit down and do it in kind of one fell swoop in one transaction. That's kind of the thinking behind door-to-door isn't as valuable this time around, but man, it really drove that awareness. So let's take that awareness, let's harness it, and let's translate that into some more events that really focus on the, hey, come here, let's sit down and let's actually do this. So that's kind of the thinking around all that. That was helpful.
Do we have any other questions? Ms. Kerr? Any questions from you? And how about our ex officio members? Any questions?
No, thank you.
Great. Thank you very much. I really appreciated your report, Jeremy.
Thank you very much.
All right, just an update for everyone. Our Texas candidate has arrived. What I would like to do is see if we can get through the next two items by about 3 o'clock, because one needs to be a possible action, but we can report informational recording. So let's see if we can try 30 seconds. Okay. All right, let's go through, and then maybe we can take a 5 or 10 minute break and go to the interview process by no later than 3:15. I'll try and get Ms. Edmonds on the phone at that time. And all right, so let's move on to item number 9, the supported state-based marketplace transition update. This report will be presented by David Haycock. Mr. Haycock.
Thank you, Madam Chair. For the record, Damon Haycock. I will try to make this 7-page report with 3 attachments as quickly and thoroughly as possible to meet that time frame. The purpose of this report is... Right, thank you. So the purpose is to provide the board and the public with a status update on the transition to the supported state-based marketplace. We began this project on May 20th of this year when the board voted to move forward with the supported state-based marketplace model. We initially assigned a project manager and then obtained project management office support from Natoma Technologies. At the beginning of this project and even up until this week, we have had initial fact-finding meetings with the Centers for Medicare and Medicaid Services, or CMS, with their subject matter experts to truly understand what the board has voted for and what we are going to receive come November 15th. All of these meetings included participation from sister agencies and contract support, which I'll go over here in a little bit. This project is a testament to a large amount of collaboration. This is not a one project for one organization with one result. Since the May 20th board decision, we have met regularly with a lot of partners, sometimes as much as 4 times per week. We've met with Centers for, again, Medicare and Medicaid Services, CMS. We've met with our sister agencies, the Division of Welfare and Supportive Services, the Nevada Division of Insurance, Enterprise IT Services, of course, Natoma Technologies, who is supporting as our project management office, as well as Deloitte Consulting, who is supporting the welfare, PCG Consulting, which supports both us and welfare on independent verification and validation. We've met consistently with our insurance carriers. Exchange enrollment facilitators are starting to come into this process as we learn more information. Of course, our insurance brokers and agents, and as you've heard earlier, KPS3 is helping us with developing our landing page. So, because we've had a lot of these meetings with CMS, there have been numerous questions where at this point in time, there haven't been answers. And to understand why we are embarking on a journey here as a supported state-based marketplace, and we are pioneering this process along with Oregon, and it appears New Mexico has also joined this participation. So there is no regulation, there is no process or procedure that is outlined, there is no 1 year or 8 or 9 months of actual results that we can pull from. We're actually creating this process with our partners as we move forward. We, of course, work diligently with all of our partners because we want that collaborative response. This is a state of Nevada result, and since Nevadans all need health insurance, they all are going to go through whatever entry point we can collectively put together, and they're going to enroll in health insurance in the best manner possible. And so again, I can't stress enough how important the collaboration is with all the folks that are participating on this project. The initial requirements included things that the CMS has called the milestones. These are a series of requirements for us to meet, deadlines and scheduling. Artifacts is what they're calling them, so that way we can prove to our federal partners that we are prepared to join the supported state-based marketplace model. There are technical configurations, setup and transition, IT security, organization and resources, our scheduling, plan management, eligibility and enrollment capability, hub capability, and reporting and oversight. So we've had an initial review of these milestones by the Exchange, Welfare, the Division of Insurance, IV&V, and our Project Management Office. And of course, we've all turned up more questions than answers, as this document was originally geared more towards the implementation of a fully fledged, federally facilitated marketplace with deadlines that already passed by the time we received it. So we received it in June, and there was already some May 30th deadlines that had gone by. However, all parties have reviewed the milestones, and we've provided input that has been and will continue to be submitted monthly. Our partners at CMS have understood the timelines and understood our questions, and as I mentioned earlier, where we are embarking on this journey together, we are figuring it out collectively, and a lot of those required dates are soft dates, and they're allowed to be pushed a bit as we discover what are the appropriate responses. An initial project management plan has been developed, and if you remember on May 20th, the board approved not only the transition to the supported state-based marketplace, but also to end the relationship with Xerox Healthcare LLC, as well as develop a procurement for a transition system or transfer system into the state of Nevada. And so the project management office support that we have, Natoma Technologies, has graciously put together a project management plan currently that encompasses all 3 of these tracks. So it is, at this point, over 140 pages, which I didn't feel was appropriate to attach to this report. nor go over it in any detail. However, by the end of this week or early next week, that plan will be separated into those 3 tracks, and I am more than willing to go over that, especially on this supported state-based marketplace project in the future. So here's the status of the actual transition itself. What is going to occur is going to completely change how the exchange operates. Now, at first glance, the website will look a bit different. It'll still have Nevada Health Link logo and skin, and you'll still type in nevadahealthlink.com to get to it. But it will no longer have the apply here or a lot of the other functionality that Nevadans are used to seeing today. It's primarily a landing page where folks will be able to come and receive information, look up assisters, look up brokers, as well as participate in a pre-screener tool. That pre-screener tool is being developed in coordination with welfare with their company Deloitte, and that pre-screener tool will help point folks hopefully to one of 2 places. They'll either go to Access Nevada, where they will participate in a single streamlined application to enroll in Medicaid or Nevada Checkup, as well as their SNAP and TANF programs, or they will be directed to healthcare.gov, where they'll be able to create an account and start the process through the single streamlined application through healthcare.gov. Once they complete that application to healthcare.gov, they will receive an eligibility determination. That eligibility determination, if it does point them back towards Medicaid, there will be an account transfer process where those individuals will then be sent over at a soon-to-be delivered date. I don't know if it'll be immediately, I don't know if it'll be in that evening or in the next couple business days, but that information will be transferred over on an account transfer process to Medicaid, where it will be imported into their system, and then they will be able to help those folks enroll in those programs. If the eligibility determination at healthcare.gov comes up with you are qualified for a qualified health plan with a advanced premium tax credit or cost sharing reductions, they will be able to put their plan in their cart very similarly that they can today. And from that process, the Fed, CMS, will then send over the 834 enrollment file to the carriers, and the carriers will then be able to create the initial invoice binder payment, sent out to the customer to pay, and once they pay, they will be effectively enrolled in health insurance. So a lot of it is similar to what we're doing today, but who are the players and who is actually touching the data has changed dramatically. We are also participating, or not participating, we are developing a very robust carrier onboarding process. This is new for our insurance carriers, many of which, or not many, but a couple, have never participated with the federally facilitated marketplace or healthcare.gov before. And currently our team lead, Laura Rich, our quality assurance officer, is set up and has ongoing meetings with each of the carriers and the carriers as a whole, as we ensure that they are prepared to sign up with the healthcare.gov and obtain the appropriate credentials so that they can start the testing process so they can receive those enrollment files. On that page 4 of 7 here, you will see a table that shows some of the deadlines that the carriers need to adhere to. One of them has already gone by, which they have successfully met, which is the binder submission to the Nevada Division of Insurance. We have distributed a general carrier onboarding schedule, as well as technical guidance and documentation to assist our carriers through this electronic file transfer process and joining up with the federal infrastructure. And right now they're completing the registration and they're waiting for CMS approval in order to finalize the connection process. As far as plan certification, in this model, the Nevada Division of Insurance retains authority over rate review. They will also continue plan certification on behalf of the exchange. So all qualified health plans must still satisfy all requirements established by the board and be compliant with all state and federal rules in order to be certified for 2015. The Division of Insurance, Exchange, and participating carriers are all having frequent conversations. Already another major medical carrier will be participating on the exchange next year. And there's a link in this report that you can read the article itself that goes over this new entry to our marketplace. Time Insurance Company.
David?
Yes.
I apologize for the interruption. We are getting to the point where we're going to start running out of time to get through Mr. Gilbert's interview, and we do have one more vote that we need to ask the board to do as well. Is there any information in your report that you would really like to point out to the board, or can we wrap this thing up? I apologize.
Not a problem. I'll wrap it up in 30 seconds. There is first attachment is the schedule. You'll see that we're basically on schedule with all of the processes that we're moving forward. There's a couple of yellow lines that we have some caution on, that is related to the IT security requirements that CMS has not fully vetted yet and finalized. And more, also equally important is attachment, I think it's attachment B, the second one. There's an exchange state-based marketplace to support a state-based marketplace comparison. And if you take the time and go over this process, you'll see basically what you're getting and what you're losing. And with that, I can end the report.
Mr. Haycock, I'm sorry to have rushed you on that, but we are getting pressured a little bit about, we're gonna lose members at 4 o'clock, and I wanna make sure we have enough discussion time, so I too apologize for interrupting you. But I have read through the report, and it's very comprehensive, and I appreciate that, thank you.
No problem, Madam Chair, and I could always go over this at our next monthly meeting if that pleases the board. This will be a recurring report every month.
Right, and I appreciate it. And if board members have specific questions for you, they can call you and talk to you about the report as well. So again, I apologize for rushing you on that. The possible action item is an update on the individual billing transition to the exchange carriers by Xerox. Ms. Bruce?
Yes, if you recall at the last board meeting, we talked about the fact that with the process that David just talked about and transitioning and the carrier enrollment and getting set up on the new system, there just isn't the time. We have run out of runway to get the new billing transitioned over to the carriers on the current system. And I believe that Mr. Belcourt had advised that since the board had voted for that transition to take place, that we should bring that back to the board, agendize it so that you could vote then to accept that we are not going to go down that path. So that is why it is on your agenda today.
That is the discussion item. The staff did not want to be counter to the directions of the board, but again, making Xerox and the carriers move down the path where we know we don't have enough time seems like a waste of time and energy for everyone. So are there any questions about that agenda item?
This is Dr. Ford, just to clarify, so we would stay with the current system, which is that the exchange bills itself through Xerox. An earlier discussion about getting people to help us with that process is the current plan.
Yes. Any other questions? All right, may I have a motion to approve then?
Just Dr. Ford, I move that the staff continue in the current direction of billing through Xerox.
I don't know how to phrase this. How about we rescind direction to the staff to have the carriers do their own billing through this enrollment year?
Yes.
Reverse the previous decision.
I move to reverse the previous decision to have carriers take on billing.
And I second that motion to rescind that our Xerox and current carriers take on the billing for this year.
Any further discussion? Okay, all in favor of the motion? Aye. Any opposed? All right, thank you very much. Why don't we take a 5-6 minute a break right now, and then let's try and get Ms. Atkins on the phone. And then, Melissa, can you get Ms. Atkins on the phone?
Yes, I will.
Excellent, thank you.
Thanks, Sandra.
Right.
I'm not sure actually how that's going to work. Yeah.
AT&T's self-conference service enter your access service by pound.
That sure does look like rain. I was checking the weather forecast as it was getting darker and darker.
We're supposed to get thunderstorms coming from the south.
Yeah.
Oh, yeah, well, I think it is thunderstorms.
I wasn't anticipating it.
Yeah, this morning they said, be ready, it'll go all afternoon.
Good deal.
I just hope it rains hard enough to clean my truck.
There are 1 participants on the call, including you. You are joining your conference as the host. For a menu of available commands, press star now.
They're bored with us.
Yes, they are. Police reviews are due at 110.
With them. Really?
We had 110 in there. Like, might as well. What was yesterday?
Somebody needs to wake up the Weather Channel. They say it's fair.
It's fair outside?
Is it raining out there right now? Yes.
It's fairly wet outside.
That is awesome. It's weird. It's such a common good day. It's hard to find.
You can turn it up.
I'm okay still. It takes a while to cool down.
Yeah, I know. This was the one over here that turned the heat up
No, I didn't.
and got us all to debate.
Hello?
Hello?
Hello. This is Lynn. Can anyone hear me?
Hi, Lynn. This is CJ. Can you hear me?
I can hear you, CJ.
Okay, when they come back on, when we unmute the south, you'll be able to hear there as well.
Okay, and I'm just gonna mute my phone, I guess, and then if Barbara chats with me, then I'll put it back on.
That sounds great. We appreciate it. We should be going again here in about 4 minutes or so.
Thanks, CJ.
Thank you. So that must be our other. So it worked.
Sunny and bright. So is that holding you at all?
Do what? Save $600 a year? Yes. That's what it's helping you do.
That's about it.
I don't want to get my insurance canceled. I'm honest with everything I eat, I'm just not completely honest.
So you exclude your liquid intake.
You know, I put water in diet soda now. But no, I actually have a 95, 90 calories, please. Really?
I mean, a sandwich is like 600 calories,
Yeah.
so you can have 6 beers to every sandwich. That sounds about worth the 90 calories.
Oh, yeah. Yeah, right. Good try on that one.
It is.
Oh,
It is.
You can triple that.
No, because I don't put sugar in it.
Oh.
So I just put spoon in it. So it's just the whatever that I put in there. So it's
And what do you use? Yeah, what kind? So I was introduced to Tito's when I was over the lake.
I've taken him back to homeschooling this year. He finished 7th grade at Sage Ridge, but he's going into 8th grade. I'm doing a high school curriculum with him just because he's kind of more ready for high school. We're doing like, right now he's doing BYU online algebra. I want to get him through algebra over the summer. And we're doing kind of this program where he reads essays by great authors and writes essays about the essays, essays and short stories. It's called the Junior Great Books program. So that's kind of a, whenever you ask that question, what grade are your kids? I was like,
Sure.
About 3 different grades, both of them. They're.
I mean, I guess you'd say if you were to move them into a school, what grade would you put them in, given what you're doing with him, and that's kind of, you're not in one place.
Yeah.
I suppose you really do.
It's difficult. If you were to go back to the magnet program, he'd just be with all the other magnet kids in 8th grade if you were to go in, because they do an advanced curriculum anyway. He did the magnet program for a while, but it was, he's socially kind of immature and completely freaked out on a huge campus, which is where the magnets are located.
What magnet school?
There was, by the time we got him in, we put him in a charter school at first, which didn't work out. I put him in Mendive, because we were going for Pine, and I wasn't that excited about Pine. He's like really sensitive, the older guy is. And so I just, and he was floundering. Mickey does very well in tests, but if you don't kind of follow him around, do your homework. He does not do the homework at all. And so I had to chase him around and say, wait, homework. Discussion time. And then he'll give me like with English, it's like, if he gives me an ambiguous response that sounds good, it if I wasn't really listening, it would sound really good. And then I started asking probing questions, and I noticed that he hadn't read it. And he like trying to get away with that. Any teacher he can. So I need to chase that guy down.
But it's more of the
We'll see when we get out of here.
But when he actually starts thinking about it, he's
it's right.
kind of a neat kid.
But that is interesting to know because
I don't know if it's
we get a lot of questions.
Mickey or
What's it
boys
called?
or what. So he's kind of fun to do that.
Let's do it ever. That's why.
Kind of like they sound similar. He works harder.
Yes, we do.
But he does like a lot of gymnastics.
Lynn, you're on?
It gives him a lot more discipline.
Okay, we're just waiting for our sleep.
He's used to somebody.
All right.
There'll be consequences,
I've drawn my feet so much until.
Okay, that's fine, thank you.
If I don't do what I say I'm gonna do, it's gonna be 20 ropes in my future and 100, push-ups or something. So that's kind of, that's been, I guess, ground into him for years now from the gymnastics coaches. So he's kind of a little more disciplined. But it could just be personality that you put up with.
You're welcome. You're welcome. Come on, I'll make you alone.
I can hear him eating.
I know. So it must be nice to be Steven today.
Sitting in the back, relaxing.
All right, so we got Lynn on the phone, Miss Atkins is there, we're back on the record. And so we've now moved back to agenda item number 4, interviewing the candidates. So, Mr. Bruce Gilbert has arrived in after having a canceled flight and mechanical difficulties. And I also wanted to extend my apologies to everyone for last week. My husband had a death in the family, and so we can't, I needed to fly back east for those services, and that's why we canceled the meeting last week. So with that, we have additional news today.
Ms. Leanne Easton, who helped us at the last interview process, who is the HR director for the state, sent me an email from David Hawes, and it reads as such: Dear Ms. Easton, thank you for taking my call. As indicated in our earlier conversation, I wish to withdraw my name from consideration for the executive director position with the Silver State Health Insurance Exchange. I truly appreciate the challenges that the exchange has and their need for an experienced executive director that is able to tackle the many nuances required of the position. Please extend my full appreciation to the board for their interest. I wish them the very best. Sincerely, Dave Haas. So we will be interviewing one candidate today, and that will be Mr. Bruce Gilbert. We had an extensive set of interview questions with him about 10, 12 days ago that took 45 minutes. This is intended to be a follow-up session, so we had some personal interaction with all the candidates. And so if Mr. Bruce, you would go get him, and if he wants to bring some water with him, that would be great.
Thank you.
Mr. Gilbert, would you like a little bit of water before we start this?
I think
She's gonna go get it for you.
Thank you so much, Madam Chair.
Persistence got you here. Canceled flight, mechanical difficulties.
Nothing but fun.
Anyway, we had quite an interview session with you via Skype last time, and the board really wanted to have be able to do some follow-up questions with you today so we could personally interact with you, and we thank you for taking a full day of travel to get here. I think we will have 5 follow-up questions, and each one of the board members will, or most of us will have the opportunity of asking you a question, and we're going to start with our member, Dr. Florence Jameson.
Doctor,
Welcome.
thank you so much.
It certainly, I have a much clearer picture of you than I had on Skype.
I'm smaller than I appear on the screen.
There are a lot of leadership roles when it comes to the Silver State Health Exchange. They include the board leadership, that of the executive director, along with the governor and the legislature. How do you see the leadership role of the executive director fitting in with the others mentioned?
That's a really good question. In my experience, when I was the benefits administrator for the state of Ohio, one of the requirements that I had to deal with was sort of a matrix system. I worked with the governor's office. I worked with the joint committee, which was both the union employees and the non-union employees in terms of putting together the health plan. You have to wear a lot of different hats. There's no question about that. There's no one leadership style that fits all of those situations. You really have to be fluid because there are different expectations with each of those constituencies. And I think that that's probably the most important thing to keep in mind is that you can't be just one person or just one way. When you're dealing in this type of an environment and you're talking about all of the accoutrements that come with it, and I use that word very loosely, but there's a lot of public interest in what you do. There's a lot of political interest in what you do. You really have to be able to not just wear a lot of different hats, but really be a pretty flexible individual to work a lot of different ways with people and find the most successful way to work with each of those constituencies.
Thank you very much.
Thank you.
Our member, Marie Kerr, is up in Carson City today, but she also has a question for you. Thank you. There, the camera's gonna zoom in on her a little bit for you.
Good afternoon, Mr. Gilbert. Thanks for coming out to visit with us. How would you describe the difference between leadership and management?
There's a significant difference between leadership and management. Many people can manage, not that many people can be a leader.
Manager makes sure that every single detail is attended to, that the work that has to be done, in fact, is done. But a manager is not necessarily a person who can bring an enterprise or a group along with them and move them forward. It's still a sense of purpose and a sense of mission. And I think that, in my mind, that's probably the deepest difference between the two. A manager is more technical in terms of scope, whereas a leader has a greater obligation, sort of more global, when it comes to the organization. I hope that answered you.
And then, Ms. Johnstone? Good afternoon.
Good afternoon.
The exchange does not have a lot of staff, as you may be aware, but their knowledge and their work ethic and drive is, I think, very well respected across the state. How would you integrate yourself into that kind of setting?
It's a really interesting question. When you have a group that works well together, there's really no need to come in and shuffle cards or do any of that sort of thing. Generally, when I sit down with a group such as you and I talk to folks, you know, we talk about three basic questions, okay? Which is, what has to actually happen? What is it that has to occur as a result of our meeting, as a result of somebody coming in and becoming the executive director? We also talk about, what would you like to see happen? You know, that's something that it would be nice if it happens, but it doesn't have to. Perhaps the most important of the questions that we consider is, what absolutely cannot happen? And in this particular case, what I believe would absolutely cannot happen is for there to be a deterioration, if you will, in terms of the staff's morale, in terms of the staff's outlook. You know, the fact of the matter is, there are lots of critics out there about what you do and about this as a whole. It's easy to be a critic, but you folks, as people sitting in this room, would say, okay, I accept responsibility for that if we're going to have a good outcome. Staff is the same way. They accept responsibility, they're accountable for it, and they're here to provide a good outcome. And so generally speaking, when I find myself in a situation through staff, we take some time to introduce ourselves one to the other and learn the way that we work best. You know, not everybody is a racehorse, but there are some great slow and steady people who always get the job done. And you have to be able to filter that. You have to be able to understand that and to deal with people and recognize the way that they work best. And so most probably what I would do is spend a significant period of time at the outset really learning about the staff, who they are, what they do, where their strengths lie, and trying to get an assessment on my own of how best to utilize them as we move this enterprise forward.
Next question is coming from Dr. Judith Ford.
Hi, I hadn't met you last time, I apologize. My question is, in the coming months, this board will need to decide whether to stay with healthcare.gov or initiate a change with a new vendor for its business system. It is likely that not all the facts will be known, how well healthcare.gov is working for the state of Nevada when this decision needs to be made. What would be the key factors that you would consider in making your recommendations to this board?
Okay. Living with ambiguity is always very interesting. It's really interesting. I was on my way here today, and it was just an extraordinary experience. I had a flight canceled, this, that, and the other, and I was really unhappy. And then I thought to myself, you know something? If you take a look at this and really think about it, it's kind of like what the exchange is going through. Okay? Here's what happened. We go on to Southwest, and I make a reservation. And basically what I say is, I'm going to give you X amount of dollars, and at this time, you're going to fly me from this place to this place, safely, but within the time frame that I'm expecting. Pretty simple stuff, okay? And it was going great, right until about 4 o'clock this morning, when they decided that the promise that they made, they could not keep. Okay, and so what had been their problem, which is transporting me from point A to point B on a time schedule that I chose, suddenly became my problem this morning, okay? That's what you want to think about as you talk about what to do with the exchange going forward. What we don't want to have happen is the consumer all of a sudden trying to do something, and then what should have been our problem That is, making sure that they sign up appropriately, making sure that premiums are collected and dispersed, making sure the coverage is in place. We don't want that to become their problem. And that's really important. There's always going to be some ambiguity, and no one's ever going to be absolutely certain what the rate force will be. There are a number of issues that have to be considered. Do you really want to simply be part of healthcare.gov? Is that the impetus? Is that what you want to see happen? Strategically is what I'm asking. That's something for the board to decide as we talk. Is it important? Does it make sense that you have a separate exchange? Again, that's a strategic question. What I will tell you is this. Your primary problem is not technology, okay? There are exchanges out there, technology out there, software out there. They've been doing enrollment for years and years and years and years electronically. The issue is not the technology. Your issue is execution. Not all the I's are being dotted, not all the T's are being crossed. You know, one of the things, I took a look at the Deloitte assessment, one of the things that bothered me terribly when I read it was all of the testing that was being done was internal to them, as opposed to any actual user experience. That's very unusual. You know, when I've been involved in projects like that, my charge to my folks has been, get on the system and try and break it. Let's see how it works. Let's make sure it works the way that it's supposed to work. And those are the kind of things I guess that are important to me. The first thing we have to do is reach a strategic decision as to whether, as a board, this is the path or that is the path. We'll talk about that and come to that decision together. And based upon the board strategy, the executive director's responsibility is to execute, is to make sure that whichever strategy is chosen, that strategy is put into place and that every single I is dotted, T's are crossed, attention is paid to detail, so that we're not in Southwest Airlines. That's what we're today. So, I hope that was helpful.
And last question will come from Lavon Lewis.
That's it. Sorry you had such trouble getting in.
I had no idea it was so hard to get to Henderson.
Now that you have gone through the first interview assessment, tell us why you want this position and how are you going to ensure the success of the associate.
Well, that's really easy. Thank you so much. Let's talk about why I'm interested in this particular position. Now, the fact of the matter is, if you're involved in the health insurance market and in healthcare generally, this is a very exciting time. It's an earth-shaking time. Things are changing radically and dramatically. And to be sort of inside that circle of change, as opposed to outside, to really be able to affect the lives of people and their ability to secure affordable insurance, that's a tremendous legacy. It really is. I've come to the point in my career where I would love to have a legacy in terms of working with the board. That's really what drives me. It's what led me to Ohio to work as the executive director of the School Employees Healthcare Board. My job there was to think about, consider, to identify, evaluate, and help the board choose amongst best practices for health insurance plans. That was 200,000 people whose lives we were touching. That's a very big, it's not a big job, but it's a big responsibility. This job here, this is a big responsibility too, in a very different way though. The fact of the matter is, it has all sorts of promise. It has all sorts of promise. There is the opportunity to really make a difference, to really, I think, fundamentally change the way health insurance is purchased in the state of Nevada. And beyond just that, I mean, it's going to remake the markets in the way that you look at it. I find that very attractive. I'm here because I think I can do it. The fact of the matter is I've had success in similar situations. Q-Quill likes to call me the guy who moves the chains. You guys can use somebody who moves the chains. And that's what I do. Now, let's turn to the more difficult part of your question, which is, how can I guarantee success? And to be absolutely honest with you, Ms. Lewis, I cannot guarantee success. I can't guarantee anything other than I will show up every day, I will work as hard as I can, I will do everything that I know how to do so that we have a positive outcome in this. I wish I could tell you I have a magic formula that'll say, oh, here we go. But I don't. The only thing that I know how to do is identify issues, understand process, work hard to get my arms around things, make sure that details are understood and dealt with, and do the best that I can and that the board can. And that's what I will bring you. You know, I am persistent. I'm really persistent. I'm a pain persistent. But you know what? I get stuff done. And that's probably the sum and substance of who and what I am. I would love the opportunity to work with you. I really would. I think it's a tremendous challenge. We've got some significant challenges, and not just in terms of technology. I mean, the public eye is on us. They're just on us, and it's going to stay on us. And that makes it hard sometimes, you know? It's hard to own up. It's hard to own things. You know, it's really easy to try and do things. It's hard to own things. I'm really good at owning things. Sometimes that's not a good thing, but I'm really good at owning things. And I think that together, we just need to own this. We need to find a way to do it. We need to do what it takes to do it. You know, and as I cautioned when we first spoke, sometimes I'm extremely candid, and sometimes I can be downright blunt. But I will tell you something, and you know this already, what you do is important. It's critical. It has a tremendous effect on the people of this state. So I'd love to be a part of helping you move that forward and making it what it can be. Thank you.
Before we excuse you from the room so that we can have some discussion among ourselves, is there anything that you would like to ask the board?
Now, as I said, normally when I sit here, I say, you know, what is it that you want to happen? I understand that, I really do. You know, what can't happen? Yeah, I understand that too, really well. But let me ask sort of that middle question, which is, if you had your druthers, okay, what is it that you want this to be? What is it that you're looking to make this? What is it that in your vision, in your eyes, it is? Because that's really the driving force behind whatever the executive director does. It's the understanding of the board, it's the vision of the board, and it's his job to bring that into reality. So my question to you is, what is it? What is it that we really want to do? Besides put together the exchange and have it run properly, I mean, that I know. But what, if you had your druthers, what is it you want at the end of this process? Yes, ma'am.
We know the Affordable Care Act is not universal health care, but we know it was created to fill quite a gap as much as it could. And we want to see that maximized. We want everybody that can be insured through either the expanded Medicaid or a qualified health plan, everybody that can be insured or have Medicaid to achieve that in this state. And that means we have to have a system in place that will accomplish that. It would be so wonderful.
Think what a powerful goal that is. Just think about that for a second. It's a tremendous goal.
Yeah, but we can do it.
Have to do it. It's not
We will.
whether you can,
We will do it.
got to.
I'd like to see it done with great ease too.
Okay, I can't even fly here well, so
No, I'm saying from a consumer standpoint.
But you know, that's again, that's a really important point. You know, the fact of the matter is, the consumer has expectations, just like I did today. And when those things go off the rails, there was a very nice fellow on the flight who gave me 2 drink coupons. And you know what? I still wasn't happy. And the fact of the matter is, we have some very unhappy consumers out there, okay? That we're going to have to deal with, number one. But number two, we have to do everything within our power so that that does not replicate. We have to make sure it never happens. When you talk about what can't happen, that cannot happen. And we have to do whatever it takes for that not to happen.
I would like to add one thing. I think it was very important to the board in the last 3 years that I've sat here to set up an exchange that was sensitive to Nevada's needs, not just the consumer's needs, but the marketplace needs. It's a very unique state in terms of patient populations, and I think that's been a goal of the exchange, not the main goal, obviously, but to be sensitive to the Nevada market. And so I think that's kind of a cycle of the exchange, is to be sensitive to what's happening at a state level.
Well, and I think to some degree that drives your consumers. So that makes a lot of sense. You know, the fact of the matter is you have to understand the marketplace. You have to understand what's going to generate that buying impulse. You have to understand what's going to make it happen. And so understanding your market, that is, you know, the populace, the demographics, and all those things, absolutely crucial and critical. I agree, absolutely.
Thank you.
Well, thank you so much. I really appreciate your time and your patience in waiting for me. Y'all have a good one, all right?
Thank you so much. I hope your flight down is easier.
I doubt it, but I'm going to hope so. Thank
You do have 2 coupons.
you. I do.
Use them wisely.
We only have one life.
Right.
I know.
If you could just tell me that, I would prefer to say that my wife would prefer to. No. Okay, that'd be great. Did one thing they apply?
Respect for those related.
Well, I must be. Right. All right, I think it's.
These consumers are not set up on this agenda.
I'm starting that last you know what? I don't want the privacy.
Sean?
Yes.
Okay.
All right. Sorry.
So his only flight home is at 5:40 tonight. So he can stay probably for another 10-15 minutes. Otherwise, we can call him later. So let's start the discussion with board members on his interview. Yes.
I just want to, Florence Jameson, for the record, just want a point of clarification. Since we have the other candidate drop out, is there any concern about reaching down to the candidate that was for an interview since that would drop out? Or is that okay, we just proceed?
You know, no, we're okay and we can proceed and the board can say, I really like this gentleman and he's gonna be a good fit, or the board can say they're not that comfortable. Reaching down to the next level would mean that we have to go through that primary 45-minute interview process, develop a whole bunch of other similar type questions because those questions are all now public, and then start this other process. So you're talking about a time lag there. I think it would be important for the staff and the board to either make a decision today, one way or another.
Florence Jimison, for the record, after having reviewed his CV, his resume, these 2 interviews that we've gone through, I would say that I definitely feel he has the skills required for this job. Both the technical skills, people skills, and even though he says he could be a pain for the staff, I think he has the passion for this job as well. So I feel very, very good about this candidate at this point.
Let's get some feedback from everyone, including our ex officio members.
Jump right in there.
Jump right in.
Yeah.
Well, I did not have the benefit of hearing all the prior candidates as they went through their question and answer period, nor did I hear this candidate's full answer to the prior questions. I did feel that he had some excellent answers to the questions that were asked today. You know, a perspective on the distinction between leadership and management, I think is outstanding. I think the perspective on can you guarantee success is realistic. And I think the question that really faces the board is the chemistry right between this candidate, the staff, and you to move this forward, both from a tactical and a strategic perspective.
This is Dr. Ford for the record. I'd like Shauna's input on that, since you know the staff better than I do.
Oh, wow. So I will say that over the last couple of years, as all of the leaders, you know, Damon and CJ and Laura and Carrie, as we have interviewed different people, generally once they get through that application process and you have the people sitting in front of you, it's not about their skill. It really is, are they going to fit in at the exchange? We are so small and we are so tight, and it really is what you just said, the chemistry of it. It's very difficult to say, is there chemistry with, you know, such a short time. And we run into that with every interview that we have, right? And you always hope for the best. I think that he comes across as very warm. He comes across as not being stuffy, you know, that he could give us a solid answer and support you when you needed it and kind of kick you in the butt when you needed it too, obviously. He was very clear on that. I think that he might give that to the board as well. It sounded like he could be very candid and let you know what's going on. And I think that's very important to you at this point, because we've heard that from you over the last couple of months, that you want to know everything that's happening. So I think that given this candidate versus other candidates, I think that he is an excellent candidate, and I don't know that going out for another round of candidates would net you any more. It's never going to be perfect. It's never going to be a guarantee. As he said, there's no guarantee of success. And it seems like he has a well-rounded background, and I think he could bring a lot to the exchange.
Actually, I was pleased to see him press forward, even though he had every reason not to show up for a 15-minute interview in person.
So, well, I certainly felt that he answered one of our questions. I thought when we asked what would be the key factors we would consider, so whether or not we would stay with healthcare.gov or move, you know, to our own exchange, and he kind of said, answered that with a question, you know, which I thought was very appropriate. He actually said, well, we would have to decide what do we want to do. You know, do we want to be part of healthcare.gov, or do we want to develop something on our own? And I thought that was a very good answer to that question. And I also appreciated his discussion on the difference between a leader and a manager. I thought that was very succinct and appropriate.
Ms. Atkins, I think you have us on mute, but I wanted to just get some feedback from you if you wanted to comment at this point.
Yes, thank you. It sounded to me like the interview went very, very well. I thought he interviewed really well. I think one of the most important things is his passion and interest and excitement about the job. And it's going to be a very challenging, especially year ahead. And I think having someone looking forward to that much is going to make all the difference in the world. So I thought it went well. I'm really glad we brought him back in. I wish I was there, but it seemed I'm watching online though, so I can also see kind of the interview. I thought it went well, and I think he's like an excellent candidate, and that's where I am.
Thank you. Ms. Kerr?
I think it's unfortunate that he had to go through the Southwest fiasco this morning, but in a way it was good. No, really. He showed how he is put in a bad situation, he's probably exhausted and under pressure, and comes forward in an interview in a public hearing very well, and comes across to the audience very well, and is able to explain himself and answer truthfully, all under pressure, and having had gone through quite a fun experience in the morning, or the whole morning. So I think he's a good candidate.
I'm gonna do this just in fairness to something we keep saying, Southwest, and I love Southwest. I got this with United yesterday, so, they all have the mechanical delays and everything else, but Ms. Johnstone,
I'm really glad that we had him back for a second interview. My impression is very positive about him today. He had good, succinct answers, and I got a better idea of his ability to look at the big picture as well as the detailed management tasks that are in front of him.
is the board wanting to make a decision today? Does anybody want to make a motion? Yes.
I'm definitely ready to make a decision, so I'll make a motion. I would like to move that,
Bruce Gill.
got it, yes, that, we, offer Bruce Gilbert, the job as the, executive director of the Silver State Exchange.
Is there a second to that motion?
Sorry, Ford, I second.
Thank you. And all of this would be subject to all the HR requirements and full background checks that needs to be done. So I'm going to, this is an important decision, so let's do a roll call vote on this. Clerk, please. Ms. Testa?
Aye.
No, she, oh, I'm sorry.
I don't vote, but thank you.
You're right.
Somebody answer that for you.
All right, Dr. Ford.
Aye.
All right, Ms. Kerr.
Aye.
Dr. Jameson.
Aye.
Ms. Lewis.
Aye.
Ms. Johnstone.
Aye.
Vice Chair Atkins.
Aye, I'm sorry, I thought you were calling me before aye.
That's okay. And Chair Campbell.
Aye.
All right, it's unanimous. All right. Including Ms. Hester. And all of you will excuse me, I'll go talk to him for a minute. Ms. Johnstone, would you help take care of the balance of the meeting and do the meeting? I think there were some things, and then public comment for me, please.
Just a second, is it okay if I get on the phone, or is there gonna be more?
No, we're just gonna do public comment now. So thank you, Lynn. So the next item is.
Okay, thank you everyone.
Item 11 on discussion of possible action regarding dates, times, and agenda items.
Actually, first, Jameson for the record, it is actually a future agenda item, but just the discussion on follow-up on agenda item number 6. And in the future, you might get a little reporting of the monthly status of those people that enroll with qualified life events, that kind of information is very helpful.
On a stock report on a national basis or on a state?
No,
see it, how it flushes out between the two.
Thanks.
But it's helpful, obviously.
Yeah.
Any other items? Okay, we will go to public comment. Any public comment in Carson City?
None, thank you.
Any public comment in Henderson? Hearing none, we can close the meeting.
Wait, don't close it, don't close it, don't close it, don't close it. Two seconds, please.
Mr. Gilbert has a minute, and I wanted to formally offer it for everyone here to get a formal acceptance from him. I told him there was one condition, he has to learn how to stay in Nevada.
Growing up out east, I would tell you.
It'll be quick. You'll learn.
I will learn to say Nevada.
Our board unanimously supports you as the new executive director, and we'd like to formally offer the position to you, and we'd like to know if you would like to.
I would be absolutely delighted to, and look very much forward to working with each and every one of you.
Thank you. Welcome.
Thank you so much. Thank you. Nevada. I got it. There you go. I'm working it. Thank you to each and every one of you. I really appreciate it. Very much.
So, that's 15 minutes to say what they want.
They're all adjourned. The meeting's adjourned.
Okay. Quickly and safely, it's never worth rushing. No, and even as an obstetrician, that will not rush to delivery because it's not worth it.
Okay, you tell this guy.
I
You
know,
know
I saw
what?
him, he's like,
You
yes,
take shit.
like 20 million times, he's up and down. So I had come in.